Hello everyone, welcome. I am James Milan and we are doing this episode of our Criminal Justice Reform series with one of our favorite guests, Chief of Police here in Arlington, Frederick Ryan. Fred, always a pleasure to talk to you.
Thank you, James. Thank you for having me.
You know, there are a number of issues that we wanted to discuss with you, and specifically we were thinking, and I'm sure this is not your favorite topic, but you've been the subject of both celebration and also have had some notable appointments recently, and I do want to get to all of that.
Okay.
And keep that focus on the success of the efforts that you have been making, the success that you've had here in Arlington, and then in increasingly wider concentric circles away from here. However, we're going to table that just for the moment because timing being what it is, just very recently, we've had a kind of very disturbing, we're just hearing a disturbing report about the comments or an article or blog post or something like that written by a member of the police department with some, let me just say that expressing some views that are troubling.
Right.
So I would ask you just to explain the situation as far as you understand it and give us an update, give our Arlington audience an update on where things are.
So an Arlington police officer in his capacity with a private nonprofit police organization known as the Mass Police Association wrote some opinion pieces in their periodical. And his opinion, as stated and as published in that periodical, are in direct conflict at many levels with the values and the mission of the Arlington Police Department, and we stand ready to oppose everything that he wrote. And now that said, you know, I'm told that it was intended to be political satire and perhaps a failed attempt at some humor, but nevertheless, his writings have consequences, and the consequences manifest themselves in compromised trust that community members have in their police department. It's my job to not only to build that trust, but to maintain that trust. And so we've taken quick measures. We've relieved that officer of his duties, and we've ordered an investigation into his writings. You know, one could argue that his writings advocate for violence.
Yeah, so without going into things chapter and verse, let's, you know, give people a sense of what it is that we're talking about. So you were saying that views were expressed there that are in direct contradiction to the values of the police department. Can you just give a couple of examples so people have an idea of what we're talking about?
Sure. So the author wrote, meet violence with violence. We've gone to extraordinary measures to train our police officers to de-escalate and use the least amount of violence absolutely necessary when trying to resolve situations. I mean, the sad reality is the overwhelming majority of our work is in the guardian role in the community. We're community guardians. But a small fraction of our work is dealing with violent people that need to be detained and prosecuted and incarcerated. We recognize that. But we've tried to get smarter about the way that we exercise the use of force. We try to drive home I forget who the wise man was that once said the art of war is winning it without ever fighting a battle. And we try to get that mindset into our police officers to outsmart those who might perpetrate violence towards others or towards police. And this notion of meeting violence with violence is not a value that we profess. It's not in any of our published materials. And I oppose completely and totally writings and opinions such as that.
Mm-hmm. Yeah, and I mean, it sounds to me like the example you just gave shows that that writing or that expression of opinion not only flies in the face of the values of the APD, but also the practices. As
Right.
you're saying, you're working in exactly the opposite direction from that.
Yeah, no question. And this really came out of left field, and we're very concerned about it. There's no question that these are concerning opinions, and people have a right to hold their police department accountable, and you have a right to hold us accountable. I always say, people throw this notion of transparency around, and transparency is important because it breeds self-correcting behavior. I think we've had this conversation before. And so we'll be transparent about this. It happened, we recognize it happened, and we'll get to the bottom of it, and we'll dispose of the matter responsibly and begin to earn that trust back of members of the community who may have lost trust in their police department. Because we're only as good as the trust that the community places in us, and we'll roll up our sleeves and we'll do what we have to do to regain that trust.
Right, because as you said, I mean, in terms of values, transparency is something that you have personally stood for, and the department itself has been clearly putting into practice on multiple levels for quite a number of years, as long as I've been aware, for sure. And rubber's hitting the road here when you're talking about something that is an internal police matter to some degree, but that has now gotten out into the public, where you do have to, there is going to be scrutiny of how it is that you treat this, and again, of how forthcoming you are about what's going on and what the deliberations and decisions are.
Well, that and the community itself, right, James? So I talk about the police department values, but those values are really community values, and through our accreditation process and our policy development process, we engage the community to try to police the community in the way that it chooses to be policed. And so we've done a lot of work around that, and I think it speaks well of the community that my inbox is filled up today. Mr. Chapdelain's inbox is filled up with emails with people holding us accountable. Hey, we read this, we're concerned about it, what are you doing about it? And the fact that we're in a community that feels comfortable confronting their police chief and their town manager with difficult issues and holding us accountable speaks well of the community itself.
Well, I'm glad to hear you say that it speaks well of the community itself, because obviously from our vantage point in a lot of ways, what it speaks well of most specifically is you and Adam Chapdelain, our town manager, et cetera, and the kind of culture that you have created as decision makers, as leaders of institutions within this community, where people will feel comfortable. It's not, if you guys had not made it manifestly clear to the Arlington population that you respect their right to do so, and that you would be responsive to their practice of doing so, then I don't think that your inbox would have been as full as it was.
And I'm under direct orders from the manager to respond to every one of those, and I will take the time tonight to do that.
I'm sure it's going to be.
It's important to do so.
I'm sure it's already been a long day, and we'll be extending quite a ways into the night. Why don't we move on for the moment at least, and hopefully for the rest of our conversation, to if not sunnier topics, at least a nicer aspect to them. And that is, I wanted to talk to you today about, well, a number of different things, but all of which relate to the Arlington Police Department's approach to policing, to policing this community, to policing the kinds of issues that can come up, and how to treat those issues. So in other words, we've talked often in the past about the opioid addiction problem, epidemic. We've called it we've described it in every way. But nonetheless, the APD has been a leader, both within this region and then more broadly, in its approach. And you were recently recognized by the AYCC, the Arlington Youth Coalition, you tell me.
Consultation Center.
Thank you, the Arlington Youth Consultation Center, with their award for this year for the work that you have done in this area and around the approach from the police perspective towards mental illness that says, hey, we are not going to criminalize this kind of behavior. We are going to look to support people in these situations as best we can. Right. So talk a little bit about that award, and also, more specifically, what it recognizes in terms of what you've been doing at the department.
Yeah, well, I was honored to accept that award on behalf of all of the men and women of the Arlington Police Department. It's not about me, it's about the work that we all have done around dealing with mental illness and people who are in crisis with behavioral issues that for many years were criminalized, and so back in '09, early '09 and 2010, we started looking. We really transitioned to becoming a more data-driven law enforcement agency. So to analyze our data, almost predict where some disorder or crime might occur, and try to direct our resources accordingly. And what we found was that in more than 10% of our calls for service, there was a documented element of mental health going on there, mental health issue going on. And that's in sort of documented cases. We know that many more, maybe didn't fall into the right button on the software program. So we recognized that was the floor, not the ceiling. And we started having conversations about, how do we manage this in a way that more aligns with community values, in a way that doesn't, dehumanize people that are suffering from mental health disorders, and in a way that directs people away from the criminal justice system, but rather into the healthcare system. And so that's when Senator Friedman was a staffer at Chief of Staff at Senator Donnelly's office.
That's our current state senator, Cindy Friedman.
Right, and Senator Friedman and I and some of our staff met, and we talked about this, and we approached the Department of Mental Health, and from that was born our co-responder model, where we have a clinician embedded into the police department, co-responding with police officers to help manage cases where mental health is an element. And what's resulted from that, James, is our arrests have gone down. We're no longer arresting people because, think about it. An officer gets sent into a critical incident. Somebody's out of control, in crisis, maybe breaking things or creating a disturbance, what have you. And officers were left really with no other tool but to put the handcuffs on. And once the handcuffs go on, you're going to court. And we were managing many of these cases through the court system, which is a waste of time, energy, and resources. And so now we hear officers will call on the radio and say, can you get the clinician right out here to help de-escalate this situation and manage these cases in a way that's smarter about them rather than just reactive. And the irony is we're having this conversation on the heels of these opinions that one of our officers wrote, and I really should point out that those opinions do not reflect the values of the overwhelming majority of Arlington police officers. The men and women do a fabulous job, and they've embraced these programs, and now it's becoming mainstream in the Commonwealth and beyond.
Yeah, I just want to make note of what you just said, that I have, personally, through my interactions with you, through this particular job of having access to more of the leaders within our community, I've also just gotten more comfortable in addressing members of the police force out and about. If I see them, I'm not going to say, oh, well, I'm glad I wasn't speeding or something like that. Yeah. But instead, I may look to engage them. And I would corroborate in my own experience what you're saying in terms of it does feel as if you are not dealing with a situation in which there's the kind of polarization as there is outside in much of the country, as we know. You're not dealing with that kind of situation within the police department. It does seem like people have signed on to this. Admittedly, if it's not radical, it was certainly a significant change.
Culturally, it was a huge change.
Yeah, in terms of the way that you were approaching basic police work.
A civilian coming in the police car with us on a call, it was met with legitimate resistance. I'm not criticizing the officer. You know, change is hard in any organization. And so, you know, we manage that, and now it's, you know, we now have 2 clinicians, and we try to have one on duty, you know, during the day right into, you know, toward midnight every day, so that we're providing these services. But, you know, we've partnered with AYCC on this, and our staff supports their staff. They've been, you know, critically important to the success of this program. In our public schools, you know, we're commonly called into our middle school and high school to help manage and help their staff manage cases where, you know, we might be teaming resources for a better outcome for the student. So it's really been an incredibly useful use of resources. You know, listen, in Arlington, our arrests are down, and so is our crime. And as far as I'm concerned, that's a good place to live.
That's as good as it gets, right?
And if we can continue to drive down arrests and continue to drive down crime by being smart about policing, you know, this whole notion of tough on crime, we've talked about this. Being tough on crime is easy work. Criminalize everything, arrest everybody, warehouse them in jails, release them, and then hit the recycle button. And just keep the revolving door. That's tough on crime as far as I'm concerned. Being smart on crime is preventing it from ever occurring, getting to the root causes of crime as a community, not as a police department operating in a silo, so that we can again drive down incidents of crime and disorder, drive down arrests, and it manifests itself in better quality of life in the community.
So let me actually ask you something that we haven't touched on a whole lot in the past, and we've had a number of conversations over the years, so there aren't that many subjects that we haven't hit in this particular way. But as I was listening to you speak, and I'm realizing, yeah, data-driven, with an understanding of what is, you know, what the difference is between criminal behavior and mental health issues, or where that intersection lies, et cetera, making sure that you guys are capable of responding to situations in the appropriate way with the appropriate personnel, as you were mentioning. All of those are yielding these great results as well. So that all sounds excellent. What I'm wondering is, from your vantage point, how do you feel and how do you approach the reality that out there in the rest of the country, there are an awful lot of police departments who are continuing, even though they're facing the same issues, and perhaps operating within communities not dissimilar from Arlington. Nonetheless, they are sticking with a, I don't know if you want to call it tried and true or something else, but a traditional approach of, you know, we will lower the crime rate by putting the criminals in jail, et cetera. How much do you get to speak to folks who have that attitude or approach to things? And how do you feel about the prospects of an Arlington Police Department type approach and an Arlington community type approach to these issues spreading more broadly?
Well, you know, and we've talked about this, I think, in one of your previous shows. We were selected by the Council on State Governments to be a national learning site for other agencies to roll out this programming. So that's given us, you know, sort of an audience that listens to what we're doing. But beyond that, I worked with a group down at Johns Hopkins School of Public Health in D.C., along with Chief Del Pozo from the Burlington, Vermont Police Department, some medical practitioners from Johns Hopkins, and a couple of former drug czars. So it was a small group of about 10 or 12 of us, and we authored the 10 standards of care that communities across America should be employing in dealing with the opiate crisis. And, you know, a lot of this is directly related to mental health. There's a lot of co-occurring disorders going on. And so we have published the 10 standards of care that any mayor or governor or city manager or town manager can go and sort of see in a white paper what their community should be doing to meet the standard of care that's really going on in other more advanced jurisdictions. And that was incredibly rewarding to sit in that room with that group of people. I learned more than I brought, and I really tried to be.
I'm sure others might contest that, but I'm going to let you go.
I try to be an active listener, and what we published from that. I mean, we locked ourselves in a room for 2 days, but for meals, I mean, we were laser focused. And what resulted from that, I think, is really an extraordinary piece of work where public safety wasn't operating in their silo and public health in their silo. We truly took the leaders across America in the same room, and it resulted in this white paper, which is I've had calls from mayors and city managers all across America, thanking us for our work and then asking for further guidance. But the point is, James, what we did in Arlington around the opiate epidemic, there was no political influence to do it. There was no community really, or a segment of the community driving us to do it. Our values drove us to do it. And, I've talked in the community about how we've moved away from being a rules-based law enforcement agency to an agency that's driven by its value system. And this whole narrative around opiate disorder being a moral failing is absurd. The science is abundantly clear that it's a medical condition no different than any other chronic medical condition, and that medication treatment therapy options result in a higher likelihood of driving down recidivism and relapse, and that we've got to be the term junkie and felon and all that stuff, and these red dots and maps, I get the value of them. They drive me crazy, because whenever I see a map with all the red dots of the fatalities, I think behind every one of those red dots is a family and love and faith, and they've lost somebody to this epidemic. And Fred Ryan's opinion, the federal government hasn't brought the necessary sense of urgency to the issue, nor the necessary resources to effectively tackle the issue. We're allowing anecdote and emotion to drive policy rather than let science drive policy.
Mm-hmm. Well, clearly science has fallen on some hard times when it comes to finding an audience on the national level at the moment. So, we'll keep our fingers crossed that can change. But for the umpteenth time, I think we're grateful to be living in a community in which the actual data, the current science, the best wisdom that you can both that you have gained from your guys' collective experience out in the field, but also that you can take from what people who are working in this area are saying. Right. Bringing all that to bear is clearly what's been happening. And
but if I may, James, there's still a lot of work to do.
Mm-hmm.
Just 2 weeks ago, I was literally coming from the State House working on this issue when I was on Concord Turnpike, when the radio call went out for an overdose, just a couple blocks from here. And so, being nearby, I responded along with other Arlington officers and firefighters, and it was a fatality, a 25-year-old young man that we all went to extraordinary measures with Narcan, and our great firefighters put the CPR machine on, and we were unable to bring him back. Most of them we are successful at reversing with Narcan,
Mm-hmm.
but this issue hasn't gone away in our community, and in many ways, we see a situation such as that as a failure. How could we have prevented this? And we go back and look at and reconstruct that case, and was that person on our radar, and could we have been more supportive to he and his loved ones? And there's a lot of work to be done. We've made progress, but we are not going to rest on our laurels. We are still laser focused. If we were losing pedestrians on Mass Ave at this rate,
Mm-hmm.
my phone would be ringing off the hook. The fact is, my phone never rings after an opiate overdose, death. And so we'll bring the sense of urgency necessary to this.
Right,
to
you
this
guys
crisis.
are the ones who know, as you just said. I mean, that's news to me that this happened a couple of weeks ago. Again, I'm paying attention as an Arlington resident to a lot of things, but I didn't know about that. So clearly we are relying on you guys being not on only on the front line of actually arriving at the home and dealing with these kinds of situations, but also understanding just how much of that is still going on,
Right.
and how urgent, therefore, the need for you to continue to advance
Right.
in this. Wanted to ask you about a couple of other things that, again, we have talked about before, but they're part and parcel of this conversation about basically various tools that that you're making, that you are using to do the work that you do, and various alternatives to incarceration that are out there. You and I have spoken before about C4RJ, Centers for Communities for Restorative Justice. I did want to note that while that is something that you and Arlington have been signed on to for quite a while, with a number of other communities, that the recent omnibus legislation that was passed in the State House on criminal justice reform includes, I believe, basically a mandate to most communities to look at integrating restorative justice as an alternative. Is that correct?
Yeah, and the legislation also empowers a commission to oversee that, to which I've been appointed.
Right. I believe that is one of the pieces of recent news that we were familiar with, is that you were appointed to this commission. Tell us a little bit about how, as you understand it, how is that going to function? Is the commission going to set up guidelines in the same way as the commission you referred to earlier, the federal commission that came out with the white paper with the 10 guidelines? Right. Is that the same kind of work that this commission is going to be doing around?
Yeah, so the legislature is mandating that we get a report to them by the end of this calendar year, which is,
accelerated.
It will be a challenge.
Yes.
But I think our report will be forward-looking in terms of, okay, what can we be doing Commonwealth-wide around bringing the notion of restorative justice to communities who are currently practicing procedural justice. And my fear, frankly, is that, this has worked so well at the municipal level, and we go from Cambridge out to central Middlesex County, and we have about 20 agencies, and it's working. We have a private nonprofit. We have two brilliant women that manage the office, both of whom are attorneys, and they manage our cases for us. My fear is, once the state steps in, a good thing could get compromised. Mm-hmm. So I'm sort of there as a defenseman to make sure what we're doing is sustainable despite the state legislation, but also to bring some subject matter expertise to the table. Our executive director, Aaron Freeborn, is also on the commission. We met yesterday with the Secretary of Public Safety up at the State House on some very preliminary discussions about the makeup of the commission and planning for our first meeting. So not only are Aaron and I on the commission, we have a leadership role in the commission. And I think that what we'll likely do, depending on the decision of the commission as a whole, but try to define what's the baseline out there in terms of restorative practices. C4RJ did a pilot program in the Malden High School over a 3-year period, where it's really been made part of the fabric of what Malden High does in dealing with student discipline. Mm. So, there are a number of different models out there. We need to sort of establish the baseline and then define the roadmap moving forward. So that's how I see the commission's work unfolding. Mm-hmm.
So I just want to clarify for the audience that that Erin Freeborn, who you were mentioning, she is the executive director of Communities for Restorative Justice, C4RJ, which is the organization that really has kind of developed this model of restorative justice that we have spoken about.
Yeah, no question. It's been highlighted, nationally on what we're doing.
Mm-hmm. I think it's I did want to follow up just a little bit on something that you said, which was, kind of surprising and had a clear ring of truth to it to me. And that is, yes, we are inclined to see this as a great forward step. The fact that this is now being institutionalized in a sense by being part of this statewide legislation to be followed by implementation that the commission will be taking a role in. But I am struck, and it makes sense to me, that you would have some concerns, misgivings, something, that this is not going to scale out in the appropriate way. Why do you think that is that a question of state bureaucracy being the problem, or is it really that there's something about the way that this functions now on a municipality by municipality basis that seems just right for it?
Yeah, I guess more the latter. I mean, and a little bit of cynical, having been in this business a long time and seeing very simple matters overcomplicated at the state level. You know, I think that could be a glimpse into the future for restorative justice. So I'm approaching this from a very, we are providing this level of service in our community, and I don't want that to be compromised, you know. I once had a prosecutor, when we were talking about this, you know, sort of lean over the table and shout at me, "You're just taking care of Arlington kids." And that was intended to be a criticism. And I thought for a moment, I said, "Thank you for the compliment. That's precisely my job, to take care of Arlington kids." And what he meant was, you know, we weren't arresting and giving kids Corey records, and we were just taking care of them. When the reality is restorative justice, you know, allows us to hold youthful offenders accountable, but not give them that scarlet letter of the Corey record that follows in the rest of their lives. And again, if we can do that in a community and we drive down recidivism of those involved youthful offenders, what a great place to live. And we just managed the 14 offender case at Arlington High with 14 restorative circles, and Naomi Greenfield, one of the Human Rights Commissioners, co-chairs, just tells a moving story about how she sat in the room with the offender who painted the swastika, and how as part of the restorative process, that offender, who we will not identify, and we keep all that stuff very confidential, but that offender was required to travel with her to the Holocaust Memorial in Boston and learn about Naomi's heritage and how her family, many of whom were Holocaust survivors, they had lunch together, they took the tea back. And what a great outcome that would have been prohibited in the criminal justice system.
Yeah, and again, just to remind people, what we're talking about is an incident from last spring where a number of students at the high school broke in after hours, I believe, and vandalized the property, and also, you know, left behind some, you know, what could be called hate speech. Yeah, and I'm very glad that you brought that up. In fact, because I do know that in the months since then, I have heard various Arlington residents expressing some concern and skepticism about whether this was another version of us taking care of Arlington kids. In other words, whether they were going to really get something that we as a community would feel good about, whether what these kids were going to take away from this was going to be something that we could feel good about, as opposed to just ensuring that this is not a blemish on their record going forward, et cetera. Right. People have expressed concerns about that, and I think you've just given a really good example of the kind of thing that is it's part of the resolution that comes about through a restorative justice process. And I think that people can understand how that trip to the Holocaust Museum, that needing to sit with the consequences or the effects on somebody else of what it was that he or she had done. You know, hopefully people get that sense that, all right, this isn't punishment. It's not or what we think of as punishment. It's not incarceration. It's not a record. But it is something, hopefully, transformative for this person, and for the 13 others that you were mentioning as well.
You know, we really only have three options. We can arrest them and bring them to court. And the sad reality is that would have been about a 15-minute hearing in a courthouse. The charges would have been dismissed, and the offender's parents would have brought their checkbook and wrote a big check to the Commonwealth of Massachusetts, said go through the circular door at the courthouse, case be over.
Never have to think about it again.
Within 24 hours, it's in their rearview mirror. In the restorative process, there's many months of work that goes on. There's work that leads up to the opening restorative circle. The circle defines the contract. The offender then goes back into the community and completes their responsibilities pursuant to the defined contract. There's then a closing circle to see, did the offender meet their obligations? If they did, it's closed. If they didn't, we go the traditional route to the courthouse. And the third option is do nothing. I would argue, and I'm open to constructive feedback, that option 1 and option 3 are off the table in many cases. And option 2, the restorative process, is a far more valuable outcome for all involved, including victims.
Let me just follow up on one other thing that you had alluded to in talking about this, the anticipated spread of restorative justice to more communities. I'm wondering, another thing that I've heard, and I've sometimes thought myself as I looked at the communities who have been involved with C4RJ over the last number of years, it's a lot of suburban communities. And what are your thoughts to extending this alternative into communities that, again, have much higher diversity, perhaps higher crime rates in general, et cetera? How do you think, is this promising? Is there going to be some trouble with again, adapting this within communities?
I'm curious, have you tapped my telephone, James? So just in the past couple of days, I've been on the phone with the Chelsea police chief, who is joining C4RJ, as well as the Winthrop police chief in Suffolk County. So 2 Suffolk County agencies are affiliating with C4RJ, and a candidate for Suffolk County DA, Rachel Rollins, will be the keynote speaker at C4RJ's annual meeting coming up in November. And she has stated publicly during her campaign that she embraces the notion of restorative justice and seeks to become more involved in dealing with first-time youthful offenders in Suffolk County. But I will point out, although we maintain confidentiality around these cases, the demographics of some of the cases that we've managed in Arlington have not been all white Arlington kids.
What people would think.
Right.
So do you think, again, that there's not going to be, it's not going to be difficult to take this model and again, put it into practice?
Yeah. Short answer is no. It will become a function of good policy, good training, and understand. See, the value of working in Arlington is, our Board of Selectmen, our town manager, the community as a whole, when they know that we're well-intended, they allow us to take risk. And, one of these cases could have gone sideways. No question about it. One of these offenders could have gone out and committed a subsequent violent crime and would have to answer to the community. And I get that. And I should have to answer to the community. But we work in an environment that embraces that risk-taking for the good of the order. Because the only way to move the dial is to take risk, make mistakes, learn from mistakes, get up, brush yourself off, and carry on. And so in communities that are that culturally mature, I think, it's easy to implement. In communities where people are operating in silos and have that us versus them culture, it would be very difficult to implement. And so Chief Kai's over in Chelsea, who's a real progressive and professional police chief in a diverse and complicated city such as Chelsea, they've done an extraordinary job along with the city manager, creating that culture that really very similar to what we have here in Arlington. And so they'll be embracing restorative justice. They already do it with high-risk gang offenders in Chelsea through an organization known as ROCA. But the chief wants to have sort of wraparound for other youthful offenders, both in the schools and in the community.
You had said earlier that in reference to the opioid epidemic, the opioid epidemic here in Arlington as well as beyond, that the police department will not be resting on its laurels, that there's been clear progress made, but that much work still to be done. What are a couple of other areas that you've identified where there's still lots of work to be done?
I'm really glad you asked that. So we are working on a macro level data project that's been funded by the Arnold Foundation through the Middlesex Sheriff's Office. Sheriff Katusian and I are working on this together. And what we're doing, James, is data, while we tend to work well together with other governmental agencies, our data is all within its own silos.
Mm-hmm.
And so we did some research with Cambridge PD and Arlington PD around super utilizers of the various systems. So look at police, look at EMS, look at public health, look at the emergency department. And you might see the same person using, in a window of time, we found one person that used police services in Arlington 53 separate times. EMS services 24 times. Public health services a dozen times. Emergency department 30-some times. And when you package that all together, we have a super utilizer that all these various systems are expending resources on. So what we're looking to do is develop a system countywide where we can identify those super utilizers of the various systems and then get proactive about bringing resources to those individuals to prevent harm and really more cost effectively as governments provide services to these people. And so that's really a fascinating project. We've hired a woman who's actually here from Arlington to manage the project. She has a data sort of scientist that has been teamed up with her. We're working on all the IT stuff, which is way over my head, about bringing all these data sets and to start generating reports so that we can be better about the deployment of our resources. It's a fascinating project.
Yeah, and that's a great illustration of, people hear data-driven. It's very much of a kind of buzz term. I know that you have used it many times in our conversations. I have a sense of what that means, and that is that you're looking to make sure that something is effective, that something has been tried, and where scientific methods have been used to evaluate whether it's effective or not, et cetera. But this is a great illustration of the fact of how macro data, as you were saying, when analyzed in the appropriate way and made accessible to somebody who can do that across a broad spectrum, can pull out individual people and stories that then again, like you said, as far as the system is concerned, the system will be able to operate more effectively because you're not spending such a disproportionate amount of your resources on individuals. But also, clearly, anybody who has availed themselves of of the police services and the other ones that many times, this is a person who is, through that data, making as much of a cry for help as you can, right? And it's a way of responding and saving those lives one by one as well.
Yeah, it's complicated stuff, but we've even taken it a step further. So Senator Friedman got some funding in the current fiscal year state budget to pilot a restoration center. So because the question becomes, okay, we've identified this group of super utilizers. What do we do now?
What do we do now, right?
Yeah. And many of those cases can be managed through our social workers and our clinicians and a number of other strategies that we're talking about. But others will, the homeless and some of the people really in crisis. Senator Friedman from Arlington has gotten the funding for what we're calling a restoration center. So we will have an actual bricks and mortar location where people can be directed to or transported to get some of the necessary services to prevent access to all these other services. And the theory is that by the expenditure of this energy and data analysis in the Restoration Center, is that when we do the math in the bottom right-hand corner, we will have expended fewer taxpayer dollars by being smarter about what we're doing.
Mm-hmm. Possibly, my last topic to ask you about is something you just mentioned, and that is the homeless. Mm-hmm. I, again, know from talking to folks around Arlington that there is a range of opinions about how much of an issue homelessness is in Arlington, ranging from people who say, there aren't any homeless here, to people who feel very much like this is one of the more urgent things that need to be addressed. You guys have a privileged perspective on this in the same way as you do with the opiate situation. Talk to us about homelessness in Arlington.
Probably the most complex social issue we deal with, because of what you just said. There are opinions on both, good people with opinions on both ends of the spectrum and everything in between. But there's no question that approaching the homeless population with the traditional style of policing is ineffective. And so I've communicated with people that commute to Alewife Station, and there are some homeless living up in the eaves of the bridge, and that's creating a sense of fear among some of the people that are commuting. And so it's my responsibility, or the police department's responsibility, to deal with that fear. We can't ignore that. That's an issue. But just reacting and going and removing the homeless is ineffective policy. So what we've done is we've teamed up with Arlington Health and Human Services. I mean, we have an amazing partnership with Christine Bongiorno and her team and AYCC, and we've designated an Arlington police officer. And what our goal is to get to know each one of these homeless people on a first name basis. No different than we do the merchants in East Arlington. We're not assigning value to people's lives. They're homeless, they're in our jurisdiction, their safety is important to us. And what's resulted from that has been fascinating. So Officer Brian White is our officer that's been, and again, it's taking time. It's like any other relationship, right? Get to know each other on a first name basis, build that trust, and from those trusting relationships results problem solving. And so one of the issues was discarded trash, also hypodermic syringes. But with respect to the trash, Officer White came back and he was rummaging around. What do you need? He said, do we have any extra rakes? I'm trying to negotiate a deal with the homeless group to rake up the debris during the day, and he coordinated with our Public Works Department to pick it up so that when the commuters come back in the evening, optically, as they pass through this area, it addresses the fear. And so, we said, well, run down to Ace Hardware and have them send us a bill. And Ace Hardware was kind enough, and he bought 2 rakes. And so this is the way these issues get resolved.
Right. Very mundane issues, but attended to on a daily basis is the way to change. Yeah.
And so now the homeless population are engaged in problem-solving conversations with Officer White and the staff at Health and Human Services, and everybody's, working together to resolve the issue rather than the police coming in, not respecting the property of the homeless. I mean, what they carry with them is all they have in life. We have to respect their belongings.
Right, in the same way as you respect somebody's house.
Somebody's house in Morningside. We have to that same respect. And we've done a lot of training with our police officers around that. And we've made some progress, James. Again, a lot of work to be done. There's criticism of us. I get that. Some of it's valid. As I said, it's one of the most difficult social issues as a police chief I've had to deal with. But I would argue, and argue strongly, that our compassionate approach and our problem-solving approach has better outcomes than the law and order approach.
Well, Chief, it needs to be said that on a day that is again, is started tough for you and is going to be as long a day as you've had. You carved out an hour of your time or more to spend with us. We very much appreciate it. We really do. I want to make sure before we let you go that there's nothing, again, I often do this and you often respond. Is there anything that you'd like to share with the audience that we haven't covered so far?
Yeah, one of the initiatives we're working on is we're bringing up some certified trainers from Washington, D.C., from the Police Executive Research Forum, to train our entire department on a really new and evolving approach to police use of force. And the irony is we had this, situation this morning with the officers' opinion pieces, but literally while all of that is going on, Captain Flaherty briefed me today on our planning on this new approach to dealing with use of force. Much of it is a result of some research done by the Police Executive Research Forum on best practices around use of force. So we're taking our de-escalation training and bringing it to a higher level through what's known as ICAT training. You're gonna ask me what the acronym stands for. I can't recall. It's really in its infancy, but we're excited about bringing that and again getting smarter about these chaotic situations that oftentimes police officers get thrown into, and bringing our training to that next level and not resting on our laurels. Complacency is a bad place to be. So, while we strive for excellence, there's a lot of work to be done, and we recognize that, and we're relentless at striving for excellence.
Well, you are a smart man, and you run a smart department.
Well, thank you.
I'm sure we will be chatting again when, as soon as we have another reason to do so. But as I have often done in the past, but always feel compelled to do, on behalf of myself, ACMi, and the Arlington community, I do want to thank you for spending the time with us today, but also for what you do day in and day out, along with the other men and women of the Arlington Police Department. We are in good hands. We know it, and we know that we're lucky.
Oh, thank you, and your partnership is important to us. It really is.
All right, thank you,
James.
Sir. We'll conclude our conversation for today with Chief Frederick Ryan, and we will welcome him back, I'm sure, in the not too distant future for more insights and more information that we can all use and feel good about in a world in which that is in mighty short supply. So for now, we'll say goodbye both to Chief Ryan and to you, and welcome you back again soon. I'm James Milan. This has been our Criminal Justice Reform Series, and we'll see you soon.